It is a common myth that pineapple causes miscarriage.
Hi everyone, welcome to AskMeDoctor, a video series about women's health. I'm Hazel from motherhood.com.my. Our topic for today is miscarriage and abortion. Early pregnancy loss can be heartbreaking and affect a woman not only emotionally but also physically. Millions of women experience it, but it's still difficult to discuss it openly. Today, we have invited Dr. Cheng to answer our top 10 questions about miscarriage and abortion. Hello, Dr. Tan.
Hi, I'm Dr. Cheng. I'm the Obstetrician and Gynaecologist in Tung Shin Hospital.
Number 10. What is miscarriage?
Miscarriage, a pregnancy loss, is defined as the spontaneous demise of a pregnancy before the fetus reaches its viability.
Number 9. Does the man or woman's age leads to a high risk of miscarriage?
Women's age is particularly associated with the risk of pregnancy loss. Now, the risk of pregnancy loss is lowest among the age of 20 to 35 years. It rapidly increases after the age of 40. The pregnancy or pregnancy loss miscarriage is around 10 to 15%.
Number 8. Will cooling food cause miscarriage? It is believed that pineapple is a cooling food and that you should avoid it during pregnancy. But is it true, Dr. Tan?
It is a common myth that pineapple causes miscarriage. This is due to the fact that it contains a content known as bromelain. This is an enzyme that breaks down protein, which is found in pineapple. It's very unlikely for a normal consumption of pineapple will cause any issue to the pregnancy. While one author actually suggests that the pregnant woman would probably need to eat about 10 whole pineapples in one sitting in order to accumulate enough amount of bromelain for it to be problematic to the pregnancy. We normally advise pregnant women to eat clean, cooked food at normal amount, as we know that excessive consumption of any particular one type of food is not healthy.
Number 7. So then what are the common causes of miscarriage?
Age is the main risk factor for pregnancy loss. There are other conditions such as antiphospholipid syndromes, hypothyroidism, abnormal uterine anatomy, which are also associated with recurrent pregnancy loss.
Number 6. Will I go through a miscarriage as well if my mother or sister has been through it?
This will depend on the underlying cause of the miscarriage. If there's a genetic component that causes recurrent miscarriage, then it is possible. Parental karyotyping may be offered if there's a strong family history of miscarriage.
Number 5. What is the chance for my baby to be defected if I experience a miscarriage in the past?
The prevalence of pregnancy loss miscarriage is around 10 to 15%. Majority of the cases, the subsequent pregnancy will be normal. If there is recurrent pregnancy losses, then further investigation is indicated.
Number 4. How to overcome overwhelming emotion after a miscarriage?
Feeling sad is part of the grieving process. There are various support groups available. It helps to talk to others with similar experiences before. Some ladies may subsequently suffer from depression, and it is crucial to seek help from healthcare professionals if you feel that the emotion is too overwhelming.
Number 3. What treatments are available to avoid miscarriage occurring?
The treatment depends on the underlying causes of the miscarriage, and different causes will have different treatment plan. Your doctor may consider to investigate for antiphospholipid antibodies, perform a thyroid screening, assess the anatomy of the uterus, assess the male lifestyle factors, and they may also consider to check for the sperm DNA fragmentations.
Number 2. Can the baby survive if the mother had an ectopic pregnancy?
Ectopic pregnancy means that the baby is not in the womb. The baby will not survive. Common place of the ectopic pregnancies is in the fallopian tube. Ectopic pregnancy is an emergency as when the baby starts to grow, eventually the tube will start to bleed. If it is diagnosed early, it may be treated with injections using methotrexate. This can shrink the pregnancy tissue. If it is diagnosed much later, a surgical treatment is indicated. Assuming that we have excluded the possible causes as mentioned previously, there are also a few risk factors that are strongly associated with recurrent miscarriage. Among them includes smoking, maternal obesity or significantly underweight, excessive alcohol consumption.
Number 1. Does abortion hurt during and after the process?
Tummy cramps, pain, vaginal bleeding are commonly associated with spontaneous pregnancy loss. If the pregnancy loss is complete, the symptoms will improve. If the bleeding and the pain persist, it is likely that the miscarriage is incomplete. Now, please seek medical attention if you experience any vaginal bleeding or abdominal pain when you are pregnant.
Thank you Get Doc and Dr. Tan for answering our questions today. For more videos about women's health, check out our other videos on Ask Me Doctor series. Also, sign up for Get Doc Plus today so that you can make your appointment before a consultation with Dr. Tan. If you're pregnant or know someone who is pregnant, you're now entitled to receive a Parentcraft kit worth 75 ringgit when you sign up for Motherhood Parentcraft class. Thank you for watching our video. I'm Hazel. See you.